When you look at the population of ICU nurses in Mulago, there are not even so many. So this is the reason why I say, if, God forbid, if the number of cases increase, then we may be in a very terrible storm. A very terrible storm. Leaving aside that, the PPEs, even for the general wards, they are not there. Somebody is using this kind of mask. This is a surgical mask, and you may find a nurse using a surgical mask for 2 weeks because there is no replacement. It is not there. And whatever has been brought from Nitil, it is a clothing material. Several times they have said medical personnel should put on the N95, or else the disposable like this one, this surgical mask, that you can easily use for a short time and discard, get another one. But because they are not there, I don't know what to say about it. We use it and reuse it. And the clothing material that was brought by Nitil, I just don't have a sample here. It is a kind of wash material that if you used it today and you wash it tomorrow, it keeps enlarging. I believe it creates a lot of pores in it that I don't think is so genuine for use the next day or any other time. And then you can't iron it because the type of material used, it's like plastic, so you can't iron it. It just becomes flabby, and actually most of them are very light. They just fall off here. So I don't know what we are in. That's why, to me, as Miss, I feel we are not very, very ready as a country. Not so ready. We could be ready, but not very, very ready to manage this pandemic if it storms more or it hits us more than what it is now. Yeah. So more nurses need to be trained on the management of the COVID-19. Not only ICU nurses. In this country, there are very few ICU nurses, very few. Myself, I'm still pursuing a course in critical care. I've not even finished it. So I can't even say I'm one of the critical care nurses because I haven't finished the course. Yeah? And whoever is there, it is training on job. So if they could do that, and we have this good number of people who are skillful enough to manage cases of COVID-19, then that would be good.
We are nurses, yes. There are nurses who are working in COVID, doctors who are working in COVID. But remember, even outside the COVID isolation center, there are nurses working. They are more exposed, I can tell you, because these patients at times they reach us before they go to these isolation units. You first see them, you first attend to them. So we are very much exposed, we are working, we are not giving up. Up to now we are serving, but we are not getting allowance, especially for this COVID period.
Nelson Robert, I'm a nurse. I've been caring for COVID patients in Mulago National Referral Hospital. It's been a very good experience to care for COVID patients. At the beginning, it was a difficult experience because it's a new disease, and it was I feared it, but with the courage that I had, I managed to care for those patients. Been a lot of solidarity among health workers. We've been working as a team. We've been working as a team. As a team of doctors, nurses, laboratory staff, psychosocial team, the cleaning services, the security. So there has been a team that has managed the COVID. And indeed, we feel we've done a great job. And I still encourage health workers not to fear COVID. When you are well dressed, you are able to give a service to these Ugandans or even outsiders or non-Ugandans, because this COVID case has affected everyone. So we should leave the issue of stigma. People should not fear people who are caring for COVID. Community should know COVID can get to anybody. And therefore, I would wish to tell community that they should receive the patients who have healed of COVID and receive them well in the community, because you don't know who is going to get COVID. How would you wish to be handled in the community when you discharged from a hospital? I feel everyone should be handled the way you feel we should be handled by the community.
We still have cases at
Yes, we still have cases.
How many?
We still have 2 cases in Malawi.
Your name was again?
Bonimpa Nelson Robert. The message to the government is that the government should look at the pay of scientists who include the nurses, the doctors. They should look at providing personal protective equipment to all the health workers at the front line. Front line here, I mean even health workers who are managing non-COVID patients. They need personal protective equipment, because those personal, you do not know whether this is a COVID patient or whether it's not whether it's a COVID patient. COVID patients come from non-COVID patients. So these health workers need personal protective equipment. Government should try as much as possible to provide personal protective equipment to the frontline health workers.
Anything else?